Hello viewers, this is another episode of MediShark, and before we proceed, please, if you have not yet subscribed, please make sure you do so. Tap the like button, comment, and then also share if you find this video useful. Thank you. Today we are still on diabetes mellitus, and before I will proceed, we've discussed so many things about diabetes mellitus, the pathophysiology, the types, and then the differences. So I would like to know if you find the video useful. You can comment under. If you find anything that has triggered your interest, you can also put it under. And then if you find something that is difficult that you're not understanding, you can also put your comments under the comment section, and then I'll be there to help you out to figure it. Thank you. So today we'll be talking about some misconception regarding diabetes mellitus. Over the years, there are a lot of misconceptions, rumors concerning diabetes mellitus, and then I'm here to debunk it, tell you some of the myths and some of the truths. So let's start. So number one, people are of the view that eating too much sugar can cause diabetes mellitus, which I would say is false. It's never true. But eating too much sugar can make you to become overweight or obese. So if you are overweight or you are obese, it can prone you to having type 2 diabetes. So when you're eating too much sugar and you realize that you're becoming overweight, you can advise yourself, and then you will reduce the sugar intake. Good. Then the second one is that when you are a diabetic patient, you can't eat sugar, which is false. When you're a diabetic patient, you can include sugar in your diet, just that you have to meet up with a professional dietitian or a registered dietitian so that you can plan your diet smoothly. And then at the end, you still have diabetes, you take sugar all right, but you also be what? Okay. Just have to do the right thing at the right time. That's all. Then people are of the view that diabetes is a mild condition. You don't have to take critical care of it, which is very false. It's not true. Diabetes is a chronic condition, and if you do not take critical look at it and then you're able to give it a special treatment it's accord for, you may be finding yourself at the wrong side of the day. So you also have to treat diabetes cautiously so that you not find yourself wanting. So, and also people have the view that for diabetes it can be cured, which is not true. Diabetes can never be cured. It can only be well managed when it's being detected and identified early, and then you meet up with professional nurses and doctors. They can help you to manage it well. So these are some of the misconceptions, and then some truths regarding diabetes mellitus. For the signs and symptoms, we have classical signs known as the 3Ps. 3Ps because all the initials start with P, and the first one is polyuria. So when somebody is having diabetic mellitus, the person will exhibit what you know as polyuria. This is because there is frequent urination. When we say polyuria, it talks about frequent urination or urinating in a bulk quantity. So the person will be urinating frequently because there's increased amount of glucose within the kidney. So due to osmosis, the body have to get rid of the enough glucose, so there'll be what we call osmotic diuresis. So when osmotic diuresis occurs, you realize that you'll be having, or the patient will be exhibiting what is known as the polyuria. Also, I would like to explain how it all happens. So as we all know about osmosis, that osmosis is about movement of solvents from a higher concentration to a lower concentration across a semi-permeable membrane. So due to this movement, there's increased solutes within the kidney, which is the glucose. So the solutes, which is the glucose, as it is in its high quantity, it has to draw the fluid with it, okay, which will now cross a semi-permeable membrane, that is the cell. So drawing this fluid with it will make the body to lose a lot of fluid so that it will get rid of what the solute, which is the glucose. So in this case, the patient will be exhibiting what we known as what polyuria. Then the second one is what polyphagia. So when you talk about polyphagia, it's also known as cell starved or cell starvation. So in this scenario, there will be enough glucose within the bloodstream, but the cell will still be what will still be starved because there's insulin deficiency. As we study about the insulin, that it activates the cells or it accelerates the cells so that there'll be intake of what this glucose or protein by them. So since there is deficiency of the insulin or the insulin is not enough, the cell will be starved. So by so doing, the cell will not be taking much food or much nutrient as it's supposed to take. So your brain will be telling you that okay, you're hungry, but yet still when you eat, you'll still be hungry because the cell is what is starving, it's not getting enough nutrient as it's supposed to be. Then the third one is polydipsia. Polydipsia is about feeling of thirsty. So as there's polyuria, whereby enough fluid is what is going away, there'll be dehydration, and then your brain will keep telling you to what to replace the fluid back, which in so doing you'll be feeling what thirsty. So the classical signs, as I said, three P's: polyuria, polyphagia, and polydipsia. So you could see say the three of them they work hand in hand. So when there's polyuria and there's what dehydration and loss of water, your body will not be feeling what, thirsty, frequent thirsty. So you begin to what make sure that you replace the water by drinking, and then also you're feeling what polyphagic. That is, you'll be feeling hunger even though you just eat. So you finish eating within 15 minutes, you'll be feeling hunger again as if the whole day you have not eaten. It's not because of any organism or anything eating the food within you, just that the sugar is enough although, but the cell is not able to get those simple sugar or those simple food that it require of it. Then another signs and symptom is dehydration. So as there is polyuria, there will surely be what dehydration, because if a lot of fluid are leaving the body in their high amount or in their high quantity, there will be dehydration, and also there will be dryness of the mucosa or your mouth because there's what reduce fluid within the body. Then we also have weight loss. Weight loss because most of the times people that have type 1 diabetes they experience this form of what weight loss, since there's no insulin and then you have to depend on the insulin time to time. If the insulin is no longer coming, your body have to now fight for survival means by breaking down fats that are being stored within the muscles. So breaking down those fats with the muscles and time to time, and then the fats are depleting within the muscles, you'll begin to realize that there'll be drop in your weight, you'll be wasting, and finally there'll be what weight loss. Also, there'll be swelling of the vulva. Your vulva will begin to swell and inflame. This is because in your vulva there is a normal flora known as what candida, and this candida they are like yeast or fungi, they feed on sugar. So if there is increase in the sugar, if there's increase of sugar in your blood, and by so doing the vulva also have to start feeding the this thing, the bacteria, which are the candida with a lot of sugar, they begin to, as I said, they multiply more than they used to be. So when they begin to multiply, they will now begin to cause trouble at the vulva, causing itching, inflammation, and then they will discharge. Also, when you have diabetes mellitus, it's going to destroy your small vessels or small blood vessels. The nerve cells are going to be numb, your sensation is going to lose, and then you feel less sensation. It There will be delay wound healing, So if there's delay wound healing, eventually there can be what? Infection. Lastly, we have shock. So shock is as a result of the dehydration. So when there is too much of dehydration and then you are not able to replace it as it's supposed to be, eventually there will be a shock, which means that there's water volume deficit, then you're not able to replace it in time. So this is all about the signs and symptoms of diabetic mellitus. So in Ghana, we have certain protocols that we followed in treatment or in treating of what? Diabetic mellitus. One, which is diet. So in terms of diet, you must make sure that you avoid refined intake of sugar. So food that contains refined sugar are jams, ice cream, sweet things like toffees, all those things you need to refrain eating it, or you need to minimize it. Then also you have to appreciate the intake of refined carbohydrates with fiber. Such food include vegetables, fruits, and grains. You must make sure that you take this food in high quantity. And also, you need to take your food in a scheduled time. Okay, some people, whenever they want to take their food, unless it's closer to their bedtime, somebody may take fufu and then within 5 minutes the person will go to bed, which is a very bad habit. So in case you want to avoid um, having conditions such as diabetic mellitus, or maybe you have it but you want to modify your lifestyle, whenever you eat, make sure that at least 1 hour to 30 minutes before you go to bed. And also you have to involve yourself in a regular exercise so that your body can utilize the carbohydrate that is being what is being taken or is being stored. Because if the carbohydrate is being stored but the body is not utilizing it, it's going to affect the body in a long run. So you have to indulge yourself in regular exercise activities. Also, you need to keep monitoring yourself. So you have to be doing regular checkup. Once in a while, you have to go and screen yourself. Make sure you are clean. There's no condition that you are battling with. If you find any slight anomalies within your body, you have to go and also what report, and then you have to do the necessary investigation to find out what is wrong with you. Then um there are certain drugs that are used to treat diabetic mellitus, and so we have the oral hypoglycemic agent such as metformin and then chlorpropamide. So these are oral hypoglycemic agents that are being used during treatment of diabetic mellitus. So you can take them orally. And then we also have insulin therapy. Insulin therapy is given subcutaneously, which means that they have to give it to you, they have to inject you under your skin. It does not need to be taken through mouth or orally, because your digestive enzymes can alter the way the medication have to act effectively, or they can destroy it. So most of the times it's being given subcutaneously. So sometimes at your arm, your abdomen, or your thighs is being given over there. So that's why you have to also have some form of education. So they need to educate you about how to inject such medication, because it's not always you have to be going to the hospital facilities. So when there's a need for you to be put on insulin therapy, you'll be educated on how to use the syringe and where to also inject for yourself, if it is your arm, your thigh, or your abdomen. You'll be taught to do so. So these are the protocols that we follow in treating diabetic mellitus. There are more to it, but these are the ones that I think for our viewers they need to know for now. In case you find this video useful, you can leave a comment under, you can share, and then don't forget to tap on the like button. Thank you. We shall meet again.